Okay, so something cool happened today. We had our first volunteer for a patient profile, so you can see how we do things at AAFY, Sports and Performance Therapy. This guy. No one was dumb enough or brave enough to volunteer for profile, but luckily, I'm still trying to go hard, and I messed myself up a little bit. This morning, I was doing some power work on the assault runner with my young friend, trying to keep up, and lo and behold, my hip couldn't keep up. I feel like I pulled a muscle, probably like a rectus femoris grade 1 or 2 strain. It's not bruising, it's not swollen. I can kind of walk. It's really affected by hip extension and the combination of knee flexion. Doesn't feel great, which leads me to believe it's in that local acute trauma stage. So this is a really cool opportunity for me to talk about how I would approach these things, what I won't do, and what I will do to kind of get the ball rolling to hopefully back to doing what I want to do. So that being said, I'll start with what I'm not going to do during this initial phase. First things is I won't be doing any NSAIDs, any non-steroidal anti-inflammatory drug therapy. The body's an awesome healing machine. I don't want to do anything to get in the way of that. And I also want to respect the pain response. It's there for a reason to tell me how hard I should rehabilitate and when I should take a step back. Pain's not always the enemy. It's going to really give us a good guideline for how hard we should push things. That leads us to point number 2 of what I'm not going to do. I'm not going to ice it. So for me right now, there's a little bit of a risk reward. I don't have any problems with swelling. And I know that there's some cellular mechanisms going on as far as like starting the healing process, and we have seen that ice does impede those. My pain's at an acceptable level, so that's really the only fringe benefit that I'm missing, so I will probably not ice my injury. The third thing I won't do is I won't stop moving. I'm gonna figure out a way that I can actually use my leg, kind of start teaching my body that, hey, we need to get this thing going, we need to start using it in the right way and let it enhance the healing process. Fourth thing, I'm not gonna freak out. When something like this happens, it can be freaky. I've done the same injury in several different parts of my body. You hear a really loud pop, you get this like sickening curl in the local area. It's scary. At first I'm like, oh my God, did I kill my hip? Did something explode? Am I gonna run again? Get over the initial freak out, talk to a medical professional, and just start rolling, okay? The final thing that I'm not gonna do during this initial stage is I'm not gonna aggressively stretch. So a little counterintuitive, like it is tightening up and it's really feeling restricted, but I know that there is a stretch damage. So I'm not going to keep pushing it and forcing positions that I can't actively control during this initial stage. We'll probably talk about stretching a week or 2 from now in later videos. So more importantly, what am I gonna actually do to help the process and help myself, okay? Days 1 through 3-ish, because we know we're in that initial tissue healing stage. We got that acute stage. The first thing I'm gonna do is I'm just gonna walk a bunch. It doesn't feel great, but I'm okay with the level of pain, and I don't have more pain after walking today. So know that I'm contracting the area, that I'm getting local contractions is gonna positively enhance my end outcomes. 2, and probably the main part of my initial rehab, is just going to be positional isometrics. So that's basically, I'm thinking about what the rectus femoris can do as far as hip flexion, knee extension. I'm going to do prolonged isometrics at low intensity at my acceptable pain threshold. So it's gonna be common that you feel the area that you injured, but that's all right. We want to start the healing process. We want to start strengthening the area in tolerable low pain ranges. Hopefully over these 3 days, the amount of time that I can hold those and the intensity of my contraction will go up, and that lets me know I'm kind of progressing to the next level. Third thing for me, and if I was seeing another medical professional, would be screening my abdomen. I do have a history of sports hernia, so I'm super wary of any pain below my belly button, off to the right above the ASIs with sneezing, coughing, sitting up out of bed, anything that seems outside the realm of just local leg injury in accordance with movement. And this stage would be manual therapy. I believe in it because it has helped me in the past, and I know that with other practitioners I really trust, it can help speed me along. Hopefully, I'm in a new city, so I'm gonna have to trust my wife to do some dry needling. She's a doctor, they don't really know what they're doing, but see. And the big question is like, when do I advance? Okay, how do I get out of this initial pain stage and move on to more functional stuff? So for me, kind of setting the goal, 1 to 3 out of 10 pain with isometrics. So right now it is pretty freaking painful. So as that pain subsides and I can really contract the local muscle, I'll know that it's probably ready for something a little bit more strenuous. And when I have enough range of motion for basic isotonics. So can I hold a split stance? Can I do a low step up? Can I do some of those low contractions and have enough usable range of motion to go into my eccentrics program? So those are my goals initially. Control pain, respect the healing process, but don't shy away from doing stuff. So hopefully we'll check in about a week and I'll actually be moving and we can see what more advanced rehab looks like.